just tell me the role that you play with kids?
I'm a play therapist, and what that entails is I usually work one-to-one with children. I would see kids for about 50 minutes once a week. They're referred for a variety of reasons. Sometimes there is clear behaviour problems in the school or the nursery, which is affecting their learning. It could be aggression, very withdrawing, really non-compliant. Other times there might have been some sort of a trauma within the family. That could be bereavement, perhaps their parents, there's drug addictions, alcohol addictions in the family. That's really, the adults round about the child are quite concerned that it is affecting their development. And as adults, we're not very good speaking about our feelings. And it's doubly as hard for kids because they don't have the experiences or the cognitive skills to be able to always articulate what's going on inside. So what we find is through the play therapy, we get a real insight into what's going on, how their heads, how they're thinking, through their play, and then that then lets us, well, one, be there to support the children, to try and help them make sense of their experiences, so they're not being overwhelmed by it. They've got some level of control. They can process it and move on. And another way as well is to be helping the adults just gain a bit of understanding about what's going on, because sometimes it is very frightening when you've got a child who's very aggressive, if they're acting out, or for parents, when you don't understand, it really affects the relationship, and you can see the distance. So even just helping providing that understanding, I think it's half the battle sometimes.
Yeah, so I work sort of through movement. The referral process would be the same, different children referred for different reasons. Yes, so it's slightly different. I come from a different background. I would look really how children move or don't move, and move with children, and I think that instantly shows children that you're trying to communicate with them on their level. A lot of the time it's the body-mind connection, so it's body mastery, and if you're sort of trying to get that, then you say that's more control over feelings and emotions and that kind of idea. So yeah, I use hula hoops and balls and maybe skipping ropes and a lot of art stuff as well, and not forcing to move, but encouraging it at the same time. And as I say, that's what I would be observing, their sort of body shape, whether children sort of interact, or sort of I would reflect a lot of movement to how the children would move around the room, and looking at space. How much space you take up, and that shows a lot of confidence and self-esteem. Or yeah,
that's really interesting. It's certainly two different aspects, two different sides, and I suppose no two children are going to be the same. So it's depending on what they need and how they're going to react, or how susceptible they're going to be to different therapies.
I think as well it's both play therapy and movement, and all the creative arts therapies. It gives children a way to communicate non-verbally.
No, that's what I was going to say, non-verbally.
So if things have happened at a pre-verbal stage of life, I think you're never going to have the words to describe things or process or whatever it is. So the non-verbal communication is really important, I think, for everybody, not just children, to have that option.